Good afternoon, everybody, and welcome to the latest HelpForce webinar, which I must admit I've really been looking forward to. I'm really keen to hear people's experiences of how they've been working with other organisations to bolster the volunteering response to the COVID crisis. But firstly and most importantly, just wanted to say we hope that you're all well and you've managed to stay safe, and we really appreciate the tremendous effort that everyone has put into supporting volunteers during this time. And it's quite clear from all the feedback we've been getting on our Learning Zone and on our various social media channels, what a tremendous difference and impact volunteers have made to the whole response, and how appreciated volunteers have been during this really difficult and challenging time. And it's been great to see how much innovation there's been in the way that volunteers have been involved, both within local communities and within NHS trusts, on the wards, in the hospitals, and the emergence of things like virtual volunteering roles, where we've been able to use technology, telephones, iPads, to support people with their volunteering and to bring much needed support to patients and to staff. And I think that one of the things that we're really keen to do at HelpForce is to try and capture as much of that learning as we can and share that as widely as we can through webinars like this and through our Learning Zone, and look at ways in which we can write some of this content up and share it more widely. Because the great tragedy would be if a lot of this great work was lost and it wasn't sustainable. We think and we believe, talking to folks like yourselves and talking to others, that one of the much needed upsides or the silver linings to the very dark COVID cloud has been the way that people have thought differently about volunteers and volunteering and the way that they've engaged them. And we think there's a tremendous opportunity to build on that as we go forward, and to develop new innovative ways of involving volunteers. And where in the past we've recognised that there's a case to be made to leadership, both in terms of trust leadership but also clinical leadership about the role of volunteers, we think that some of the engagement that we've seen over the last few weeks, couple of months, has helped us make that case more strongly. So we're hoping that there's a more fertile ground for volunteering to thrive and develop as we go forward. So the theme of today's webinar is very much to give you all an opportunity to reflect on the way that we've developed more integrated approaches to our volunteering, working cross boundaries, across organisations and across sectors, working with different parts of the NHS, maybe working with different voluntary and community sector organisations, and working with community-based organisations that in the past perhaps we haven't worked with, or maybe even had sight of in the past. And I'm really delighted that we've got three great speakers who are really happy to share their own experiences for our benefit. And hopefully we'll have some time at the end for you all to chip in with your particular experiences. As I say, we're keen and we will actively be seeking examples so that we can put them up on our Learning Zone and share them more widely. But if you want to make a contribution or ask a question, the usual thing, if you go to the questions box and hand or enter a question there in a natural way, we'll try and manage that as best you can. I'm going to shut up now and hand over to Sally, who will introduce our three speakers.
Hi everyone, and welcome, and thanks for joining us. As Mark said, we've got three people who've put themselves forward just to share their experiences for a few minutes, mainly to get the conversation going and to spark some ideas and to get everybody engaged. So thank you to Steve Manley, Ian Jones and Kathy Walsh. Steve will be joining us a little bit later in the session. So if I can ask Ian Jones from Volunteer Cornwall to join us. Ian, are you there?
Yep. Good morning. Good afternoon now. It's afternoon now.
Thank you.
Yeah. Do you want me to kick off?
Yes, please.
Yeah, right. I'm Ian Jones. I'm Chief Executive of Volunteer Cornwall. It's a charity set up over 40 years ago to develop social capital in Cornwall. We've got various projects, probably about 50 staff. Probably for the last 6 years, I've been working more and more closely with our system, health and care system, looking at integration. We're one of the pioneer organisations, and I sit on a number of boards with health and care, the Urgent Emergency Care Board, the Community Services Board, and the Workforce Strategy Board. So we're tied in strategically. So when the pandemic hit, we were already part of the system, working with acute hospitals, community hospitals, and also social care. There was a recognition that the voluntary sector and volunteers are part of the system, part of the workforce, and have to be sort of integrated in terms of what we're doing as clinicians and as what we're doing as social care staff, etc. Cornwall was divided into 3 areas: West, Central, and East, with 6 integrated care communities and 14 primary care networks. So we already started taking a place-based approach to how we support people. We have various projects like high intensity user projects, looking at those who use the system most, and we consider them that the system's abandoned them because they're too complex, and we've got some great results there. Part of our work around place-based work, integrating local volunteers with primary care and also community health, was a program I did with the medical director of the Cornwall Foundation Trust and the primary care network director for St Austell area as part of NHS Leadership Academy, Yale. So we already started looking at how we integrate the volunteer workforce. So when the pandemic hit, the system, public system, locally looked at us and said, right, what could you do? So we started recruiting volunteers on the 3rd of March. We now currently have over 3,800 volunteers signed up, doing various things. We also work with 246 mutual aid groups, which have between 10 and 100 volunteers each. So we work with them closely as well. And we have 47 businesses and their volunteers who we're working with. We took our first referral into our volunteers on the 17th of March. And as of this morning, we have supported 2,840 individuals. A couple of weeks ago, when we hit our 2,000 mark, the NHS programme in Cornwall had supported 69. I don't think the NHS national programme is touching the size in Cornwall because what we already had established. We do many areas of work. I think the 4th of April was our highest weekly referral into us. There was over 620 people in that 1 week alone. We get on average now probably about 200 new people. So the new people number is going up, but we're probably getting several hundred now coming back for more work, more support. So that's food, medicines. We also deliver controlled drug by specifically trained and DBS volunteers. We do mental health support, low-level mental health support. We work with the Foundation Trust, making sure that some of our volunteers are already trained. We've got mentors already trained in that area. We've been helping collect, distribute with volunteers PPE. We help volunteers set up it's called Cornwall Hugs carers. So we're working with the hospitality industry, isolating workers, in particular around care homes, so they can be safe not to take things into the care homes or take things out back home. We got various projects like dog walking, many other sorts of strange and wonderful things where an older lady was really upset because she couldn't put her washing out. So I went out and put something washing line up for her. We've been working very closely with the hospitals to ensure discharge is smooth. For instance, yesterday, one gentleman who got home because his care wasn't there, but he needed face-to-face medical prompts, so we got a volunteer to do that. It was all PPE going in. We also did a trawl of all our nearly 4,000 volunteers now and identified probably about 150 who had health and care backgrounds. We're starting to use them in more specific low-level care in people's homes, because what we're noticing is an escalation of complexity of need as the lockdown continues. And we're also seeing an escalation of mental health issues. We see a lot of older people concerned about going out, but also getting frustrated that they're locked in. You know, we were talking about some civil unrest. It wasn't young people who might be throwing stones. It might be older people as they start getting out because they're getting frustrated. We also got a volunteer-led telephone befriending line working with, again, the Foundation Trust for key line support workers, key workers. Our trusts have their own support line, but sometimes they recognise that having a third ear outside their own organisation is useful. So we're doing that as well. We work structurally through 3 community coordination centres, which has one referral into the system from health and care. And our community makers sit there, and we have a daily huddle at each of them to identify who could support people the best or how we can join some of that services up. We're also in various discussions with care homes. We've had volunteers going in and do some of the cooking and laundry, and also in the hospitals as well, training up volunteers to help people with ICT so they can communicate with their family. And we had a workshop a couple of days ago with the Trust looking at an expected surge of mental health issues as well. So there's quite a lot going on there. I think we were lucky because we were already working closely with health and care colleagues, and they recognised us as a central point for the utilisation of that social capital, supporting their own staff, and taking some of the sort of lower level needs away from sort of district nurses. So there's a lot going on, and I think we're really keen now. We're also seeing about work around families. There's quite a bit of stress in families because of the lockdown, so starting to work with families. So that's, I know I talk very fast, but that's a brief overview of what we're doing, and it's continuing as we speak because it's not letting up.
Thank you, Ian. It's staggering the progress that you've made in such a short time. Can I ask a question about the volunteer recruitment? How did you do that? How did you get so many people so quickly?
Yeah, we look at technology as a tool, not as a solution, and we use a complex systems approach and social networks. So it's that notion of 6 degrees of separation. If you name within 6 people, they'll know the Queen. That attitude. So with our network, we've got staff on the ground who've got various networks. So each of them only speak to 6 people, and that itself is like a virus. So within a couple of days, people are coming forward because people spoke to them. And what we've noticed as well with a lot of the people we're supporting, they want to talk to a human being. I think that was the downfall of a lot of the NHS national programme, is when an older person rings in to us, they wanted conversation. Many of them are isolated, they're very worried, they want to talk to a human being about more than one issue. So they might need some food, but we end up talking about their interests and their hobbies, and then we get them involved because we then say, oh, you used to be a sailor, you're interested in boats. I tell you what, we got a group we're helping set up. You like to talk to them about it. So then they become part of the solution as well.
Thank you so much, Ian. We've got a couple of questions here, and I think the first question is gonna a very good question from Rachel. She said, if a volunteer is going into a care home to cook and do laundry, shouldn't it be a paid worker?
Totally agree. I totally agree. And that's why we're totally against what Boots and the government are doing at the moment, trying to recruit volunteers to do full-time jobs, testing people for, totally against that. But our prime concern is about the well-being of the most vulnerable members of our communities. Where we have a care home with 1/3 of the workforce either self-isolating or vulnerable themselves, temporarily we need to give them support. So we will not recruit volunteers to go in and substitute staff, but they'll go and add value in the short term. So it's not about taking away from a paid job, it's just temporary. So these volunteering roles will only be for a week or so until they get other staff in.
Thank you, Ian. Next question here we've got from Emily. Is it just volunteer Cornwall delivering all of that, or do you have a delivery partner or delivery partners?
Like I said, we've got 247 mutual aid groups. So what we tend to do, and we've got 5 staff seconded to us from the local authority. So if we get a referral, which is a straightforward one, someone needs a delivery of food, then we'll pass it to one of our colleagues who are seconded to us from the council, and they generally see if there's a community aid group who can go and do that straightforward bit of work. And we're working with a council at the moment to putting most of these groups on a platform so we can go into recovery with them, so we can start looking at more proactive activities with these people. So low level, we try to work with other groups. We work very closely with other voluntary sector organisations. What we're noticing because of the lockdown, these specialist organisations are referring to us because they can't cope with the demand on them, whether it's mental health or Age UK. So we get a lot of them coming to us saying, we got this person, can you help? So we do work closely with partners, but nearly all our work is done by the volunteers themselves.
Thank you. And this is questions for me, actually. I'm very, I find the circumstance we're in very special, obviously very different, but how do you feel what you're doing right now can be carried forward? What is your vision, I guess?
This has enabled us to move quicker on some of the more strategic things we wanted to do. So I mentioned about the 3 community coordination centres where we've got social care and health and ourselves located. We want 6 of those. We had to do 3 initially, but we want 6. And most of the work through that is done through the primary care network. So we're continuing to look at how we deliver place-based care away from acute in communities, working around the primary care networks. And I was on a conversation this morning with the Southwest Academic Health Science Network to try and put some evidence and research around that in place. So we're trying to build on the experience we've had with the pandemic in order to embed what has worked and identify what hasn't worked with that sort of structure.
Thank you so much.
Thank you, Ian.
Mark, do you want to say anything, or you okay? Hello? Sorry.
Hello?
Hello, Mark, are you there?
Yeah, no, it works better if I unmute myself, doesn't it? Work that one out. I think the scale of what you've achieved is remarkable, and it strikes me that what's happened during the whole COVID crisis is that these infrastructures have developed, as you just described, at a local level. And for me, it feels like the real challenge as we go forward is to try, and they'll necessarily be quite fragile infrastructures at this stage because they've only been existing for a few weeks. But it strikes me that the challenge going forward is how do we bolster those infrastructures, and how do we try and leverage support to you so that those infrastructures have got a life beyond the COVID crisis, because quite clearly over the next, at least 12 months, there's going to be a much greater focus on providing support to people in their own homes, and these infrastructures are going to be essential. So I think, yes. So, sorry, go on.
You're spot on there, Mark. I think you're right. I used to do economic development many years ago as well, overseas and in the UK. And I often used to say we spend millions of pounds a year promoting GDP and our economy, and we spend virtually nothing underpinning our social capital. It's saying we spend billions a year on our defence in terms of military, but what do we spend in terms of our social defence? Yeah. So I think you're right. I don't think central governments necessarily understand that. When we had Big Society with David Cameron, a few years after it was launched, before the coalition got in, I had to go to Parliament and give a presentation on Big Society and why it failed. It's because they thought you could manage it. You can't manage it. You've got to facilitate it. You've got to be there to motivate. You've got to be there to give feedback. You've got to be there to overcome problems. So part of what we do with our volunteers is when they go out and deliver food, they are also identifying other issues so that we can make sure that they don't escalate. So all that facilitation, that infrastructure, as you said, has to be put in place, and it doesn't happen overnight.
No, and I guess what's happened with what it doesn't happen overnight. What's happened over the last few weeks, it's almost been supercharged out of necessity. And I think one of the things that we as Helpforce can usefully do is to capture these stories and share those with share that learning with the centre to identify that, because it's not it's not planning and direction you need from the centre. It's probably more support. You know, it's probably more support really, and as you say, facilitation to try and do that. So that's been for me. That's been a really powerful presentation, and I think we can take a lot away from that. So
thank you.
I'm sure we will come into. I'm sure we will talk to you again.
Wow.
Yeah, thanks, Ian. Thank you.
Thank you so much, Mark and Ian. Ian, we just got two more questions for you. First one is from Joe. How are you capturing the impact?
Right. That is a question. When you're a frontline deliverer with scarce resources, collecting impact, we're collecting stories. You know, people are collecting their stories. Collecting the evidence about how it's worked is a different matter. So one of the things we're doing, and I had a conversation the other day with yourselves about the Academic Health Science Network. We're trying to get them to work with us on the King's Fund proposal, which we'll work with you on as well, to collect some of the evidence around that place-based work and how it impacts on it. So, you know, we have to have more resource to do that because we don't have the resources to look at the outcomes. We got the outcomes from how people have benefited. We've got very good outcomes and evidence for the HRU work around this. You know, it's been a hugely measured, but not the work that we just delivered, because as Mark said, it was all of a sudden we had to hit the ground running, and all our staff have been, you know, 7 days a week at it.
Mm-hmm. Thank you, Ian. And next one we got from Gillian. How are your volunteers supporting discharged patients? Are they being linked into existing NHS Trust volunteers and get involved pre-discharge?
Yeah, we had a discharge. One of our frustrations at a local level is the nature of procurement. When you're working in a community, procurement stops people working together because people look at the money and stop talking as soon as the money's dangled in front of them. So we lost our discharge project. We used to do all the discharges from the acute and community hospitals, though community hospitals are still working with us. The contractor who won the contract about 8 months ago, when the COVID hit, said they couldn't deliver it. So we're picking that up again now. So it wasn't hard for us to pick up working with our colleagues in the hospital who we already knew about identifying people who could get that support. So it didn't take long for us to pick that up straight away. And the volunteers generally are out in the community, and we work with the discharge team within the hospital to identify their needs and identify the right volunteers to support them.
Perfect. Thanks so much, Ian.
Thank you.
So I think that's all the questions we have for Ian now. But if you have more questions, please put in Q&A box or raise your hands. Thanks so much, Ian.
Thank you.
Thank you. And next one we have is Kathy Welsh. Kathy, are you there?
Yes, I'm here.
Hi, Kathy.
Hiya.
Would you like to just share a few things that you are working in partnerships in your area? Could you introduce yourself as well?
Yeah, I guess listening to what previous speakers have been saying, I feel a bit of a fraud being on this call because I haven't been doing all that stuff that you're doing. I guess just a little bit about my background. I'm an Associate Director for Patient and Carer Experience within a mental health and community trust across Cheshire and Wirral. And within my portfolio is volunteering. And we had a very active volunteer group that we used a lot around people's lived experience in supporting people with mental health problems and looking at working in communities. And we sort of had to put a lot of that on hold because of the COVID. And it was looking at how we could almost target our volunteers in a different way. And because I'm in the category of people that have to shield, I'm working at home for 12 weeks, and it's given me a lot of thinking time in terms of what things will look like when we come out through this to another side, because I know we talk about getting through this and getting to the other side. I think it'll be a different another side, and looking at how we can develop volunteering in a different way. So we're in the sort of Maslow hierarchy of needs, aren't we, where people need to get food and they need that warmth and comfort and things delivering. But as we progress and people's mental health starts to deteriorate, how can we develop volunteering in a different way, especially if people are going to be isolating much more or keeping social distances. So I've had the opportunity to talk to our local authorities across our patch, of which there are 3, and to talk with all the acute trusts across our patch about us having a conversation about how we can do things together. So when I've looked at what they're doing across in East Cheshire, they're doing very much that. They've got that infrastructure on the ground in terms of having local points connected with the primary care networks. And they've got 14 coordination points across East Cheshire, each linked to the communities. And that's where they target the volunteers to get food distributed and all the on the front line things that previous speakers have spoken about. We've got the same going on across West Cheshire in terms of their communities, and again the same in Wirral. So for me, because we cover quite a big geographical patch, we've got lots of things going on in each of the places, and people are focusing on that place-based community. But for me then, how do we get some of the capacity and some of the specialist knowledge and all that stuff that's in people's heads across the system? And I guess one of the reasons I ended up on this call with you was that I was looking at the HEE and Helpforce website e-learning, and asked one of our volunteers, Gus, if he'd like to do the e-learning and see how it was, because for me, it's if we share volunteers across, then do we have a certain standard that everybody can work to if it's in health and social care or within communities? And is there something that we can do as a system that says if you go to this one point of contact across all our services, this is the recruitment process for whichever activity you want to do? Because obviously being a mental health trust, many of our volunteers will go through the DBS checking system, etc. But for some things like looking at information leaflets or giving us feedback on certain things, you don't need that. But I think we tend to put people through a process rather than being more person-centred and looking at what people can do. So I guess for me, I was looking at across our system of Cheshire and Wirral, how could we come together to get the best of what's going on at local communities, but equally using that capacity of everybody's knowledge to do things across the system. And that's one of the things that I'm looking at the minute, and looking at whether perhaps NHS England can help us in any way do that.
Thank you so much. We've got a Jen Fox from NHS England on the call. I don't know if Jen would like to share a few thoughts.
So hi there. Yeah. So from that's really interesting. I think both listening to the first presentation, which was around the huge kind of geographically coordinated approach, and then thinking about what you're saying as well, which is again this place-based approach, and how do you enable that movement across and around the system. I think certainly from our perspective, some of the ambitions and aspirations that we've got for volunteering in terms of that longer term plan, in terms of how people are onboarded and recruited, and the standardised approach and that passporting element is something that we're really interested in. So I was interested. You've talked about East Cheshire, West Cheshire, and the Wirral, and having these coordination points on the ground. Within those areas, have they got a standardised approach? So can their volunteers within those place-based approaches move around? Because I think there's something around taking that learning that's happening at a very local level and saying, if we can do it for them, how do we take it to the next level? And who needs to be involved in those conversations? Because again, getting something agreed and standardised across a patch needs the relevant parties to be involved, and there's a question for me about who needs to sign up to this, who needs to be involved, because it can spread beyond, you know, health and care, and spread to other organisations as well in terms of that fluidity of volunteering.
Yeah, I guess for me, part of what I'm doing now is talking to localities to find out what's going on. And whether people do share volunteers. I had a recent conversation with Emma Valentine in NHS England, and she linked me up with Lancashire who've developed
Yeah.
that passport. So they do that across all their organisations.
Yeah.
So just looking at how we can legitimately pinch with pride, I guess.
Of course. And I think that's, I mean, it's not about anything being sort of special or specific to one particular place. I suppose for me, it's about how do you take those key elements that would work no matter which geography or which system or which locality you're sitting in. What are the key elements from within that make it work? And what are the elements that obviously there's going to be local variation there needs to be because of the nature of how the systems operate and the different partners that are involved and the design of, you know, services, for example. But there is something around, I think, learning from all the experiences that you're having out there in terms of, you know, achieving great things at great pace. How do we keep now the best bits of those and create something that's really valuable and useful going forwards for everyone? And what's the learning in terms of things that didn't work? So again, I think Ian touched on it, the fact that you've, you know, thrown people into new relationships and new situations, and they're still very fragile in terms of that ongoing relationship. But actually, let's not lose that. How do you build on that initial way of working and capture that in a way that we can then share from a more national perspective?
Thank you so much, Jay.
Thank you.
So does anybody have any questions for Kathy before, because we've got a question that's come up that's more of a general one, but if anyone has any questions particularly around Kathy's work, please do pop them in the Q&A box. And Kathy, is there anything else you would like to say, or are you happy for us to move on?
No, I'm happy for you to move on, and thank you for having me.
Oh, it's lovely to meet you. Thanks for joining us. So we've got quite a general question from Barry. Barry says that many volunteers are furloughed currently and available more than they possibly might have been previously. What plans are there for recruitment after COVID? And would further encouragement for corporate partners making staff available for volunteering be a solution? Does anybody have any views on that or any suggestions?
Hello?
Hello.
It's Ian. Am I still on?
Yes.
Yeah. We've been thinking about that because we have had a few of our volunteers come and say that those who have helped have got so much out of it themselves that they still want to help. So that many of them are coming back saying, I can't do it every day, but can you keep us on a list, perhaps for a weekend or an evening assistance? So we're having two databases now, one with those who can help at any time and those who might help periodically. We're also interested in talking to them about how we harness this goodwill into recovery. And most of them are really keen to help. So what we're noticing, and it's always the way, people get a lot out of it when they start helping others. So we're looking at those who can help day to day now, and then those who can help differently in the future. One of our challenges is we do have a transport team who do used to do about 50,000 journeys a month, help taking people around. A lot of those drivers are older, over 70, and now they're shielding. So we got a challenge with some of our older volunteers who are getting very frustrated because they can't do what they want to do and help by driving people around. So it's something we're thinking about at the moment.
Great, thanks, Ian.
I just want to say Maggie has sent a message. I hope everyone can see that she shared a very, very useful links for who would like to do the volunteering learning passport modules, and also the link to our Healthforce Learning Hub. If you can't see the links, do let me know and I can send you the links again. Thanks so much, Ian. We have Steve here. Steve, would you like to unmute yourself? There you go.
Hello there.
Hi, Steve.
Hi, Steve.
Would you like to introduce yourself first, and then can let us know what you're doing with your service?
Yeah, of course. Yeah, I'm Steve Manley. I'm engagement manager for North East Hampshire and Farnham CCG, and we are part of the Frimley Health and Care Integrated Care System. Apologies for joining late. I've missed the start of the conversation, so sorry if I'm duplicating anything that you've already been talking about and already said. But yeah, just wanted to share some of the work that we've been doing locally. So when I guess when the crisis started, there was a lot of work initially about sort of reorganising the way we all work. People were starting to be redeployed into different teams, and as a collaborative of CCGs, that we just moved into that space in December, so there was already a bit of movement around of new teams developing and people working in different ways. So as part of the work, something called a workforce bureau was set up to help with the redeployment of staff, specifically during this crisis. And that's moved into a very active place now. And alongside that, quite quickly, we realised that there were a lot of roles that people were talking about that volunteers could potentially support with, or we were also getting a huge amount of offers into the system of support from local community groups, from individuals, and we were also in constant communication with our voluntary sector colleagues around the recruitment that they were doing in the local area. So we decided to set up what we've called a volunteer bureau for Frimley Health and Care. And the idea is that there is a small team of us. I mean, there's only 4 or 5 of us, and we're scaling that back actually at the moment, that are there to try and provide a bit of coordination for the system. So we're not recruiting volunteers, and we're not really responding directly to the community response that is ongoing and very effective, largely supported by local authority and voluntary sector colleagues. But what we are trying to do is coordinate the need and requirement for volunteers within health and care settings, and be a one-stop shop for people within the system who work, professionals mainly that work within our system, to come to us if they have any questions or queries about volunteering. So we've compiled all the advice guidance that's come out over the past few weeks, and as I'm sure you'll all be aware, there's been quite a lot of it. So to try and just be a place that understands that, to work alongside the National NHS Volunteer Responder scheme, so that where requests come into the system that feel like they can be fulfilled by that scheme, then we will signpost people to that scheme to use it, and we're trying to monitor how effective that is locally. And I'm sure people will have different experiences of that as well. And then I think more importantly for us locally, it's about working with our voluntary sector colleagues who across Frimley Health and Care have recruited thousands of new volunteers in the last few weeks that have come forward with varying offers of support, so that if there is a particular demand within our system where we think volunteers could support, then we can work with our voluntary sector colleagues to understand how they can help place volunteers and work with us in that way. So that was the thinking behind it, and I guess it sits next to the Workforce Bureau because some of the roles around redeployment of staff were more appropriate, so it just felt a natural team to work with, because some of the need we have experienced is of more clinical nature, and we need to consider how staff go into those roles and not volunteers. So we've spent a couple of weeks setting up a process for all of this. I shared some of this on the Helpforce network. And there are some documents there, and happy to kind of to share things for people to take a look at. So we have that process there now, and it's effective. There was a flurry of initial activity, particularly around offers of support into this, that we've been able to work through. But what we are seeing now is the demand for volunteers within health and care settings has dropped significantly in the last week or so. So we're now scaling back a little bit in terms of it's becoming more of a monitoring exercise in terms of just keeping an eye on that. Is there going to be likely to be a volunteer need in the future? And also to ensure that we are able to pick up quickly and move into a more proactive phase if and when that's needed, should there be a second wave of illness in the community, or a spike in care homes, or something of that nature where we think volunteers could support. I guess one example worth giving it, where we have been able to provide some useful support, is around entertainment and activities in care homes, where we were seeing a real need for, initially it was around cleaning, it was around catering, and actually we tried to work it through, and it was decided locally for us that volunteers weren't the best route for support there, just because of the sort of requirement that was needed and the risk involved. But we also noted a growing anxiety of people, residents in care homes, because they're seeing the news, and also more loneliness and isolation because of a lack of visitors. So we've worked with volunteers in our local arts centre to think about creative ways of engaging with people in those settings. So that's just an interesting example of something that's come out of this work that we wouldn't have expected, I guess, in terms of how volunteers can support. And we're now looking more broadly at engaging with our communities, which I think I just heard as I joined the call, and kind of going back more to my old day job as an engagement manager. How do we talk to our local communities about their experiences of all of this, and how we're going to support each other going forward, and capture that community spirit? And we're thinking actively about how can we use some of those volunteers that we know are there to support with some of that work. So whether it's the simple things like answering survey, helping disseminate a survey, but also some more proactive and thinking outside the box in terms of how we can utilise volunteers to help us shape that work going forward, I guess. So that's a brief overview, but I'm happy to take any questions or to share some of that thinking and some of the documents around this going forward.
Thank you, Steve. That's been really great, and some good ideas as well. Really interested in the Volunteer Bureau and how that works, and whether it's possible to track volunteers and what happens to them, so that you could pick up with them again at a later date.
Yeah, and I think that's something we want to actively look at now, particularly. I mean, one area we haven't been able to track is around the volunteer responder scheme, and I think there is a frustration there. We have seen numbers that were floated around, and we know that there are thousands of people who signed up locally, and we would really value the opportunity to be able to reach out to them and communicate with them directly, which we haven't been able to do yet, but we would hope those numbers are large enough that they will hopefully be able to see through some of our other communication methods. They'll pick up on some of those messages. But yeah, we're less sure how active and how effective the volunteer responder scheme has been.
Thanks so much, Steve. I think we got a similar question here from Joe, who's asking, how do you capture effectiveness of impact?
I think it's a good question, and yes, there are elements where we feel like we haven't been able to do that in a way that we hoped we would, and there are others where it has been more effective. So we keep a log of all the volunteer requests that come in and all the volunteer offers, and we kind of follow those through. So they will be assigned essentially to a member of the team, who will then take it forward, whether it be liaising with the voluntary sector, liaising with the individual themselves, or liaising with teams in care homes or the CCGs or the hospitals to ensure that gap has been filled, and that those people have been placed. But on the whole, we're more of a conduit. So we're keeping a track and log of everything. And in some cases, we're actively going back to check that has worked and has been effective. And in others, where it's been more of an office for support, it's more of a signposting people so that they can talk and work through that together. So I wouldn't say we've got a really effective answer to that overall impact. And I think that's something we want to refine, I guess, as we go forward. But because we've seen the demand dropping, I think we're probably going to start moving into a different space around how we can support the next phase in recovery and what roles volunteers play there. And move away from that initial just flurry of placing people and trying to get people into different settings, because we're just not seeing the need for it now.
So it's Jane Fox here. There's a couple of things I wanted to ask, because obviously you've talked about this being like a conduit, a sort of almost a brokering service. So one of the elements is that you are getting offers of people wanting to help, and then obviously requests for help. So that for me brings us back onto that question of passporting and how, because you said you weren't recruiting, so presumably if you are recycling around or redirecting where needed. How have you addressed that challenge of going in and out of different organisations? Is there an acceptance of kind of a set of standards that are being carried out by another sort of, I'm not going to add the word employer springs to mind, but I know they're not employed, but the organisation that manages that volunteer or that service, is that being accepted and being transferred, across and between the different organisations?
Yeah, so I think it's been a bit case by case. So it's been different for different roles and different people in different organisations, and the numbers haven't been big enough to warrant us kind of thinking about that wider coordinated response yet. And we're part of that thinking earlier in the year when we were talking about a bid around integrated approaches, and there's some of that work that we're now wanting to pick up again. The passport was part of that conversation. But it's varied. Generally speaking, if a volunteer, when we've worked with the voluntary sector, that volunteer has already got the relevant training and clearance, and if they went and worked in the hospital with a short induction, then that would be accepted. So we haven't had any major issues with that. There were definitely some concerns around safeguarding of volunteers. And we haven't been able to take forward roles that initially we thought we might because of that. But equally, there hasn't been the need. So I think, therefore, we haven't gone into a discussion that perhaps we might have done had we seen a higher need, particularly in those acute settings.
Yeah.
Thank you. Thank you so much, and Steve.
Role there. Have had a sort of a set of roles that have been predominantly sort of appropriate for volunteers to step into during COVID, or has it been very much responsive to specific needs dependent on the organisation?
Yeah, it's been responsive to specific need. And again, early doors, we were looking at what's been done around the rest of the country, some of the roles that have been created in other areas, and we had all of those things sort of ready as resources to adapt and think about locally. And yeah, the need we didn't get there, so it's been case by case, really.
Yeah. Thank you. That's just really helpful, just to understand how it's actually worked operationally for you.
Yeah, no, thank you.
We have another question from Joe. I think it's quite similar. Could you share with us any key challenges when you're doing this work?
Sorry, could you just repeat that?
Yes. So Joe wanted to know what any key challenges that you have when you run the service.
Yes, the most obvious one was that we were set up out of nowhere, and we were a team of people that had never worked together before. So trying to work out what this all meant and what might work and what might not in the first place meant that I think we were behind the curve a little bit. So all the national conversation had started around volunteering and the NHS Responder Scheme. So we already had quite a few staff asking about that and what that meant. And equally, our local authority and voluntary sector colleagues were well on the way to establishing their local community response type work, which crossed over, particularly in some areas, the most obvious one being pharmacy prescription collections. So I think we managed to avoid duplication, but I think if we'd had an integrated approach like we were talking about earlier this year, already fully established, there would have been a better sense of consistency and continuity between the different organisations. I still feel that this is a health and care response that I'm talking about. It's not an integrated response in the way it could be with our local authority and voluntary sector partners. Having said that, I think it's still been a really positive experience. We're still in constant communication with each other, and we're thinking about, you know, what's next and evolving it into something else. So yeah, you know, just the nature of it and the speed of it, I think, were the biggest challenge, that it was brand new.
Thank you, Steve. I just have this question here for all of our speakers and also for our groups as well. So obviously we step into a new normal now with a lot of trusts have to see they step down their volunteers. Do you see there is a way that volunteers from NHS Trust can work with you, you know, with CCG or local authorities? Do you think there's a possibility this is going to be a new normal now? Anyone think about it? Sorry,
I have to let people think about that for a minute, V.
Joy?
Can I just jump in there? It's Jane Fox from NHS England. I think one of the things that COVID has done, which is I suppose a positive coming out of something that's been absolutely terrible, is it has forced the issue on a lot of different areas. So that, you know, might have taken years and years to achieve, have had to happen, as our last speaker mentioned, literally overnight, and, you know, catch up and run from where you've landed. I've heard the expression so many times during the briefings and the information about building the aeroplane whilst you're flying it, and it really feels as though that's something that's happened so quickly, especially in the volunteering space. So there has been that need to manage existing and current volunteers in the context of COVID, you know, standing them down where it was appropriate to do so for safety and in line with policy, etc. Also recognising, you know, volunteers' willingness to volunteer or not during the pandemic due to their own concerns. People who wanted to continue but couldn't because of the, you know, the vulnerable people, social distancing kind of rules that were put in place. And against that background of that, a whole influx of people wanting to volunteer, either in the short term because, you know, they're furloughed, they weren't working, they got, you know, time on their hands, wanted to make a difference and contribute. And then those that have wanted to volunteer, and it's been an opportunity for them to get involved really quickly and get on board quickly. And I think there's something now for us to think about in terms of the landscape has changed. We will not return to normality as we knew it, you know, 3 months ago. It will be a different landscape. Relationships have been formed across and between different organisations. Conversations have had to happen, and things have been put in place that are really positive. And I think there's a really big piece of work to be done, looking at, you know, as we go through the recovery phase, which is obviously we're in the early stage of recovery, just starting to reintroduce urgent non-COVID things into back into the system. Actually, how do we learn from and keep and retain the good bits, the elements that have worked, and not lose those? And actually, how do we start to think about and learn from the things that didn't quite work? Why didn't they quite work? And I think there's a real opportunity working with systems when the time is right to do so with yourselves, to start to try and learn and capture some of that. I think we haven't landed in that space yet where normality is returning for anyone. We're still, I think, in a bit of a fight and flight, even though we're trying to put the recovery plans in place. There is still that sort of, you know, increasing number of cases, you know, it's still a number of cases of COVID patients going in. You know, death rates are still high. There's still things happening that are very, very much COVID focused. And I think there's a real balance over the next few weeks before we'll actually be able to start saying, right, what does this now mean? What does it look like going forwards? But how do we build on and capitalise the fantastic contributions and that social asset that's been created through COVID, and retain it. So there's a real opportunity here.
Mm. And leading on from that, Jane, Kathy has put a comment, Kathy, who was speaking to us all earlier, acknowledging that there'll be many people being made redundant, and we need to look at how volunteering can give people new skills, perhaps in a different sector.
Yeah,
So,
I'm very aware there's been a significant increase in numbers of people applying to be nurses. It's quite an incredible, it has such an impact across so many things, and there's going to be some hardships, obviously, with things like redundancies, but hopefully there'll be real opportunities as well. And volunteering is something that everybody can do, and it does start to create that, experience of a different sector sometimes, or experience showing that you're still sort of contributing and have skills, etc., to offer. There's some real opportunities there, certainly.
Mm. We've just got another couple of comments, general ones. Jill would like to add to what we've just been talking about. There will be a future increase in need for volunteer support around mental health, loneliness, isolation, and of course bereavement, sadly, as well as poverty for people who may no longer have a job to go back to. So yeah, just a comment really on the situation we find ourselves in.
Yeah, that might be something just to pick up on. I don't know if the three speakers have got their own experience of this, but to what extent volunteers, because they are very much integrated as part of the workforce, certainly if they're in an acute setting, so the last speaker might want to mention this, but how are they accessing and being supported with all the things that employed staff are receiving? Is that sort of coming through, and that people are having access to that health and wellbeing support that's being provided through employers? Is it being passed through to volunteers in the same way as well? And obviously that will vary dependent on whether they're working within an organisation or if they're working out in a community. I just wonder if any views or thoughts on that from the speakers or others on the call.
Yeah, I guess from Cheshire and Wirral Partnership Trust perspective, all our volunteers are treated like members of staff. So they have access to everything that a member of staff would have in terms of our workforce wellbeing.
Yeah.
And we give them, for the volunteers that have not been able to actually do volunteering because of COVID, we've had regular check-in calls to make sure that people are okay. And lots of them have managed to do, and again, we'll be in a different world at the end of it, virtual interviews. So, how we've recruited lots of extra staff on a temporary basis. Some of our lived experience volunteers have interviewed from remotely on conference calls or video conference. And they've really enjoyed that, and have said, why don't we do this as well in future, especially for people with disabilities that can't get out of the house but would want to be involved in things like interviewing.
I mean, just something like that. We can't go back to the old way of making sure everybody sat in one room on one day. It makes life so much more easy doing it via video conferencing approaches, and hugely beneficial for things like inclusivity. It opens up a whole world for people who might be unable to leave the house or participate in activities that were run in the traditional way before COVID. So hopefully some real positives coming from that.
Brilliant, thank you both.
Steve here. Sorry, I just wanted to add in there briefly. For us, it's been very different in terms of the volunteer support has depended on where those volunteers have gone, and on the whole, they've been short-term or ad hoc sort of roles where we've been able to work with the voluntary sector to ensure that support is provided in the first instance, and then a kind of support in role from the setting they're in. But again, it's been case by case. But I also just I think it's we're about to go into an exercise around collecting public patient and public experience, and volunteers are included as part of this survey work we're doing. But it just so happened that we did a a fairly large-scale survey with our community panel, which is a representative sample of our population, just before, in fact, the survey closed on the day the country went into lockdown, around experiences and views on volunteering. So it's given us a before snapshot, and we now want to kind of do some compare and contrast and repeat some of those questions as part of this wider work, because so much has changed in such a short space of time around the views and perceptions of volunteering, and just trying to capture some thoughts, feelings and data around that, I think would be really useful. So something we can share, and I suspect others may be in the same situation with work they were doing earlier this year.
Yeah, that would be really, really helpful if that could be shared, because I think that's going to be invaluable and probably very timely that you'd got the before and the after to show that change in, you know, potential opinion around volunteering and what people's willingness to either be involved or to use a volunteering service, because a lot of people will be using volunteering services that have never accessed a volunteering service before, simply because of the constraints of isolation, self-isolating. So
thank you, Jane. Thanks, Steve.
Thank you.
And Liz has posted a comment. I'm aiming to promote volunteering with secondary and college age young people. Liz has a list of websites that show volunteering opportunities, such as Do It and Volunteering Matters. These list individual vacancies. Does anyone know of a website or platform promoting group volunteering? That might be one that people want to get back to us about afterwards if they need time to think about that. Okay. And there is a question, Jane. I don't know if you'd be in a position to answer this now, but we can forward the question to you. But it's a general question about resources for harnessing the positive outcomes from volunteering during the pandemic, and what that might look like.
That's the 64 million. Yeah, it's the $64 million question at the moment. I wish I had the answer, to be honest with you. As I say, I think one of the challenges is we are still in the midst of the COVID response, and that stepping into a recovery phase, which is only the first stage of it, and there's still a lot of unknowns. So I would hope that there will be some when we start to think about the recovery and what next, actually trying to capture this, trying to ensure that we, as I say, keep the good stuff out with the bathwater as we'll return to what the new normal is. That's something that I think we will want to build into our sort of recovery and thinking going forwards. But it's just too early to say anything at the moment, because the focus is still very much in the immediate urgent response from the perspective of where we are at the moment as a team.
That's great. Yeah, I appreciate you couldn't have answered that really, Jane.
But watch this space. I will. It's on my radar.
Yeah. Thank you. I'm conscious we've run over. Mark, did you want to say anything before we close?
Hello, Mark.
Mark, are you on mute?
No, can you hear me?
Yes, we can, thanks.
Can you hear? Yeah. Sorry, it's not a great line. I'm really keen to thank everybody for what they've shared, and I think that one of the pieces of work that we're just embarking on is with our network. To start from the point we made earlier, what support people think is needed to maintain some of those networks and infrastructures that have just started developing, because I think the danger that that they could be lost as quickly as they were established if we don't identify the right support that is to sort of capture the benefits and those forward. So this has been a really good kick-off to that process of capturing some of that needed. And I think, the things that the lasting benefit, I think, be the visibility of volunteering at a local level has really been put on the map. Those people who've been involved in it and always known it's been there, but actually the visibility of that volunteering response has been elevated, and I think that's been a positive. I think also picking up on the point about the group volunteering corporates, I mean, we know from the work that we've done with corporates through the crisis that their understanding of the needs of local community groups and their ability to provide, if you like, a disproportionate impact and support to those groups has also been elevated. So I think the relationship between the corporate sector at a local level and community groups will have been enhanced as a result of this. And I think the fact that people are working across those boundaries that perhaps were seen to be difficult to overcome a few weeks ago, which of necessity have been broken down, I think has also been helpful. So just want to thank everybody for contributing and kicking off this process of starting to capture some of the learning which we want to work with and try and get the right support out to you at a local level to continue doing the great work you're doing. So thank you all very much for that.
Thanks, Mark, and thanks everyone, and particularly Steve, Ian and Kathy for putting themselves forward, or being press ganged into putting themselves forward. It's really helped to start the conversation. It's been so interesting to hear about your work at this challenging time for everybody. I'm really sorry we're going to have to go now. Any questions that are still coming in, we will attempt to get them answered afterwards. So apologies if we didn't get round to you. We hope to catch up with you soon.
Right.
Thanks all for joining us.
Thanks very much. Thank you. Bye-bye.
Bye. Bye.
Bye.